Welcome back to another episode of Christian Natural Health. Today, I'm very pleased to have Emma Tekstra with us. Emma is an actuary, independent health researcher, and author of How to Be a Healthy Human. With a 30-year background in employee benefits and corporate health and well-being, she consults with employers looking for real solutions to runaway healthcare costs and with startup companies bringing health solutions to market. Welcome, Emma. Thanks for joining us.
Thank you so much.
Yeah, so give us the elevator pitch for your book first. What inspired you to write it?
Oh, well, I was just I've been working in corporate for many years, and I think really when the pandemic came down and just the way employers were handling it and how we were handling it here in the US compared to many other countries, because I'd been talking to our colleagues in other countries and how they've been handling it completely differently. And I
Right.
think how you would have, for example, advised your patients,
Right.
those kinds of things. We just weren't allowed to talk about it.
Right.
And so many people are just watching the headlines, I feel nowadays, where they might read a short article or watch a 3-minute YouTube video and think, oh, yeah, okay, that's explaining something to me. But
Sure.
people aren't reading the context for those
Right.
headlines. And you might read a headline this year, and then next year it seems to contradict it.
Yeah, yeah,
Just
absolutely.
refute the study or whatever. And so I just felt we needed a lot more context. We needed to delve in a little bit and see
Mhm.
the whole background as to what's going on in the healthcare industry, what's going on with big pharma, what's going on in our bodies. People don't know this anymore, how the basic workings of the human body. So
Right.
I just wanted to explain all of that and sort of give some context for those headlines that are out there to help people, I guess, interpret them a little bit better.
Yeah, absolutely. And so what I love about your book is that it's straight naturopathic theory. I mean, it's like obstacles to cure, identify and remove. Here's the basic building blocks for how to be healthy. And you do it from kind of a gently Christian perspective too. Is that right?
Yeah,
Yeah.
absolutely. I mean, for
Yeah.
me, if we're just having this conversation, I'm telling you, it's the way God has designed the body. And
Right.
if you took every doctor and every scientist across the whole world, and you took all of their knowledge and you added it all up and you looked at it, we wouldn't even scratch the surface of
Mm.
how God has created the human body to work and
Right.
work, in concert with the natural world around us.
Sure.
So if we're just having this conversation, that's absolutely where I'm coming from. But I
Right.
know that can be off-putting for some people who maybe they're not sure if they believe in God, or kind of puts that in kind of a religious perspective. And to me,
Right.
it's just reality.
Yeah. Yeah.
Reality is reality. I'm a seeker of truth, and
Right.
whether that truth is how something works scientifically,
Right.
how light waves travel,
Yeah.
or how the human body works. It's
Right.
reality, right? So,
Absolutely.
but I wanted to make sure to reach lots of different kinds of people and make sure that that wasn't too off-putting. So,
Right.
yeah, so as I say, gently, and I think if you really push people, I think deep down people know, well, there's something bigger than us. I'm
Mhm.
not quite sure what it is. I'm not quite sure what it means, but I
Right.
think there's something. So, as I said, I just wanted to lay out reality as I see it, but then for people that like, well, actually, this kind of makes sense and kind of it helps me understand the whole natural world. So actually, I want to know more, and so I go
Right.
into a bit more, I think, in the appendices.
Yeah, fabulous. Okay, and so tell us a little bit of background on like what is an actuary? How does this pertain to healthcare? I just recently learned about this myself, so I'm so excited to talk to you about this. But can you, for people that aren't familiar? Yeah.
Sure, sure. Well, it's a little nerdy, but hopefully
Yeah.
I'm not a typical actuary, I'll tell you that.
Okay.
So an actuary deals with risk and data and a
Right.
lot of numbers. And so a lot of actuaries work where I started in the pensions field.
Okay.
So if you started a job, let's say in your 30s, and you're not going to retire, so you're in your 60s, your
Mhm.
employer needs to put money away now, or you need to put money away now, so
Mhm.
that in your 60s you can retire and you can draw a pension. So that's
Right.
a function of how long are you going to live,
Uh-huh.
and as well as
Sure.
things like how to invest the money and things like that. So I
Right.
used to focus on that, but so my background as to how I wanted to veer into healthcare
Right.
was my son, actually. So my son 15 years ago, he was about 5. He was diagnosed with Asperger's and ADHD. He had a lot of health problems, a lot of learning difficulties, and I wanted to figure out, how to help him. The doctors, of course, just gave him a very poor prognosis, wanted to put him on drugs, and I
Right.
started thinking, well, hang on, there's got to be a better way. So I started researching, and
Mhm.
because I'm an actuary, I just pick up these medical studies, and actuaries are very good at statistics.
Yeah.
Really sounding. So you can see headlines out there that, something is 90% effective.
Uh-huh.
That doesn't mean that it's nearly perfect and
Yeah,
you
yeah.
take it and everything's great. That's not
Right.
at all what it means.
Right.
And so an actuary can understand and really delve into not
Yeah.
only the data, but how the data was put together. So
Mhm.
what was this population? What elements were studied? How did we account for reality and various elements that can change amongst the population? So
Right.
I was delving into these things, and I found that, well, okay, something's really wrong with the way we're approaching health.
Uh-huh.
And so there are a lot of actuaries that do work in healthcare as well, and because they can apply this sort of statistical perspective. And
Sure.
then we're also very good at taking lots of different pieces of data and
Mhm.
bringing it all together into a holistic picture as
Right.
to what's really going on.
Yeah.
So yeah, it's a little bit nerdy, but
Yeah.
hopefully I can apply it and make it a little bit more interesting. My book is not
Right.
nerdy. I've had lots of people tell me it's totally written for the
It is.
layman. It's kind of
That's
funny. I tell a lot of personal stories,
does.
but yeah, the
Yeah.
background, but it does have scientific references.
Right.
So there's
Absolutely. Yeah.
a little bit of nerdiness for those nerdy readers that want to go a
Yeah.
bit.
Yeah. Well, I kind of want to get a little nerdy right now, if that's
Okay,
okay.
go for
So,
it.
can you describe, like, first of all, who's paying the actuaries in healthcare? Like, who has an interest in doing that? And what exactly do they do in the healthcare context? Like, I know you can apply your knowledge to it, but what are they actually doing in that space right
Yeah,
now?
that is a great question.
Yeah.
So the actuaries in the healthcare field are mainly employed by the insurance companies. So
Okay.
if you think about the insurance companies, they're going to pay your medical claims, but
Okay.
they need to make sure they're going to have money to pay all those claims,
Right.
and the policies that they've signed up for, they've got enough money and enough capital to pay them all. So a
Okay.
lot of actuaries are looking at the book of business and
Uh-huh.
looking at the demographics and the population and trying to figure out, are these people going to get sick? How many heart attacks are we
Mhm.
going to have in this population? How many cancer diagnoses are we going to have in this population? And they're studying that and they're adjusting accordingly. And it's actuaries that figure out what the premium cost should be. So when
Gotcha.
I was working in a corporate world,
Right.
and you've got big employers that actually they self-insure their health plans,
Right.
which means they don't just pay insurance premiums like I'm going to pay $1,000 a month and
Mhm.
everything's taken care of. The
Sure.
very big employers literally just pay the claims.
Uh-huh.
So the employers themselves need to understand, okay, I've got this population, what's going on in my population? And
Right.
some of these employers will actually send questionnaires out to their employees to say, what are you eating? How much do you exercise? All of these kinds of things.
Yeah.
And then the actuaries try and predict
Uh-huh.
the ill health. And
Gotcha.
then they can figure out what the co-payment should be. The employers might pay a lot of it, but they're asking employees to pay some.
Right.
But how I want to come at it, it's actually kind of frustrating to me that
Yeah.
insurance companies, they're very focused on conventional healthcare.
Of
They're
course.
very
Yeah.
focused on, what are the drug costs going to be? If you're going to
Right.
get cancer, those are very expensive drugs. If you're
Sure.
going to have an autoimmune disease, if you've got lupus or
Mhm.
multiple sclerosis, those are very expensive drugs. And
Right.
how many of the population are going to be diagnosed with these things? But
Sure.
it's very it's kind of hands off. It's kind of, it's like, oh well, oh shucks, 10%
Right.
of the population have
Sure.
got diabetes or whatever. And instead I get frustrated that the insurance companies don't
Right.
cover naturopathic medicine. So a lot
Yeah.
of your patients, they're having to pay out of pocket. And
Right.
that's so frustrating, because if the insurance companies would wake up to this, that if you pay for a naturopathic physician to guide somebody in what they're eating and how much they're sleeping and maybe some nutrient deficiencies, and you take some
Sure.
supplements and would
Right.
actually subsidize quality supplements that
Right.
is going to reverse so many of these conditions,
Sure.
the insurance companies are going to win. They're going
Yeah.
to be
You
more
can save
profitable.
money. Exactly.
Right.
Right.
Right, but they're just not waking up to it yet. I mean, that's a lot of my mission now, is
Sure.
to talk to insurance companies and employers to
Right.
understand
Yeah.
that maybe paying a little more now, because if you're an employee,
Mhm.
you look at your health plan, you say, okay, I'm not feeling well. And you
Mhm.
look at your health plan and you look at the in-network doctors and you say,
Mhm.
okay, I'll go to one of them and I only have to pay $10 for the visit. And so
Mhm.
they go to that kind of a doctor, and that
Yeah.
conventional doctor says, oh, be on this drug.
Sure.
And then they look at their plan and what it's going to pay 90% of the drug. Okay, off we go. And
Right.
then they say, well, if I don't want to do that, I've now got to pay $200
Right.
for a visit for a naturopathic doctor, and they're going to recommend some supplements to me. And oh, I've got to pay in full for
Right.
those.
Oh,
What's
sure.
the employee going to do?
Of
And the
course.
employee is going to get sicker and sicker and sicker. So
Exactly.
a little
Exactly.
long-winded, but
Yeah,
that's
no, that was
actuary's
that.
role, I think, is to fix this.
Right. Yeah. So that's great background. And so side note before I get back to your story. So my understanding, again, from like I told you kind of off the air that I had originally found out about actuaries from reading an Epic Times article that was making the argument that actuaries are not doing nearly as much with insurance that they as they used to. What
Right.
changed when, why?
Big pharma.
Okay.
The power of big pharma is funding so much of the medical education, not only what the conventional doctors learn in regular medical school, but after medical school, they go to all their continuing medical education.
Yeah,
And big pharma is so funding all of that and subsidizing a lot of that.
sure.
And everything that big pharma is funding is saying, okay, there's an autoimmune condition. Here's a drug to address it, or
Sure.
there's something that doesn't have a drug to address it. Well, let's go and fund that research to find a drug.
Sure.
There's no money, there's no profit to be made in vitamins.
Uh-huh.
And if you're a conventional doctor and you've got all of this debt from medical school, this is a tough thing to say, but they've got bills to pay. And if
Right.
they're turning their patients around such that they don't need them anymore because now they're healthy and they're
Yeah.
not visiting them other than a checkup once a year,
Right.
then there's no profit in it for the doctors either. So it's a bit of a vicious cycle.
Mhm.
And so the insurance companies, they're really limiting what the actuaries are doing. The actuaries aren't out there looking at the medical studies like I'm looking at,
Sure.
like,
Okay.
what is causing lupus. There's an interesting article actually come out recently
Saw
on,
that. Yeah.
yeah, you saw
Mhm.
that on what is actually causing lupus. And,
Mhm.
and of course, the article then goes on to say, okay, that's something that the pharmaceutical companies can go research into addressing this particular, condition in the body. And I'm like, well, okay, but is it a nutrient deficiency that's causing it? Is it a lifestyle issue? Let's address
Sure.
those things that can
Yeah.
boost this particular element in the body that ends up causing lupus. So
Mhm.
it's a mixture of factors. It's obviously it's never one thing,
Sure.
but it is correct to say that we're not relying on the actuaries and the actuaries themselves. I was very frustrated in COVID, if I can kind of just go there for a moment,
Please.
that the Society of Actuaries in the US,
Uh-huh.
they put a study out about COVID and about actually what happened the following year in 2021,
Mhm.
when the mortality of young people, so the under 50s, started skyrocketing.
Yeah.
Now, just something a little bit nerdy about actuaries is that mortality is very steady. And
Mhm.
this is how life insurance can work. And this is why general life insurance is actually pretty cheap. You can
Mhm.
get very good life insurance for $50 a month. And if you pay, you can get like 4 times your salary paid out because
Sure.
mortality is very stable. So the
Mhm.
insurance companies know in a given size of population how many people are going to die each year. If
Sure.
it moves by maybe 1% in a year, the
Yeah.
actuaries start getting nervous. If it moves by 5%, you're getting the very senior people involved. In
Right.
2021, mortality of young people skyrocketed by nearly 40% in some populations. What is going on? And so the Society of Actuaries kind of talk about this. They talk about the numbers, but they kind of hid the headlines in their report, which is what happened in 2021. Oh, these shots rolled out, that very experimental methodology as to what this pharmaceutical was containing and how it would affect us. So there's things like that personally I was a little embarrassed to be an actuary
Yeah.
for a couple of years, because I think they could do a lot and they
Uh-huh.
could sound a lot of alarm bells, but either they're not being listened to or they're not comfortable speaking out. I don't know what the issues are.
Gotcha. Okay. So then that leads me back to what my other question was going to be. So you said that you started going into holistic health for your son, but then in 2020, 2021 was when you actually left being an actuary and now you're focusing on bringing the knowledge to the world with the book. Is that primarily kind of where your focus has shifted?
Yeah, I mean, I didn't get out till 2023, so I
Okay.
spent 2
Okay.
years trying to sound that alarm. I mean, I felt a
Sure.
responsibility. I'm an actuary
Right.
here. I was sending our leadership these studies, these mortality
Yeah.
studies, like something is going on, and we were recommending our corporate clients mandate these shots. I'm like, what are we doing? It's a
Yeah.
personal decision for a start off. It's not
Right.
up to your employer to decide what
Right.
a medical intervention you should
Absolutely.
take. So I was trying to sound the alarm, and after
Right.
2 years of that, and me just getting beaten down, I'm like, okay, I'm not doing. I
Absolutely.
thought I was doing good. I was doing the work that I was doing for 20 plus years because I wanted to help people. I wanted to
Right.
help employers, sure, reduce their
Right.
healthcare spend, but I
Yeah.
wanted to help the ultimate employees. And after a couple of years of beating my head against the wall, I just wasn't helping anymore. And
Right.
also because the devil is in the detail, and employers, they don't have a lot of time and they only want to look at the headlines. Even the
Right.
leadership of my company only wants to look at the headlines. I'm like, okay, I got to take a step back here, and I've got to lay out the context and put all of this detail out there
Mhm.
so that we're just not sort of focused on those headlines. So yeah, I stepped away last year to write this book so I could lay it all out.
Yeah, fabulous. So, and then again, from the angle, like approaching naturopathic theory from the angle of an actuary, looking at the data, like, so for example, what you just said about lupus, I had the
Yeah.
same thought when I read that article. I was like, they had this one line at the very the very end that was like, maybe this is because of toxicity, maybe this is because of an organism, but we're not going to go there. And so that's the kind of thing that we need somebody to look at. This is a
Yeah.
big question, but
Yeah.
how how would you use actuaries to fix healthcare, at least a little piece of it? What do you see that needs to happen?
Well, I mean, the insurance companies drive a lot, right? Because so many people,
Yeah,
especially in the US, where really if you're not insured, you just can't get healthcare.
right.
So
Yeah.
it starts with the insurance companies and the actuaries they're employing to
Mhm.
be looking at all of these different studies, not just
Sure.
focused on, the population that is on the policy right now and just kind of
Right.
making some estimates, which is kind of what they're doing right now. What happened in the last 2 years, how many people in a given population have heart attacks, and let's just apply that going forward.
Sure.
Instead, they need to look at some of these studies and
Sure.
understand holistically and look at all the things that I'm talking about in my book, the increase in toxicity, the
Right.
technology and the electromagnetic frequencies and all of the different technologies in the food, in the ultra processed food, all of these different technologies. And actually, looking at the data, that's the reality. So
Mm,
instead of looking at, well, can we say this? Can we not say that? And what is it correct? Or even bringing politics in it, politics should have nothing to do with healthcare.
amen.
Absolutely nothing.
Yes.
The human body has nothing to do with politics.
Right.
It is reality. The way the body works is reality. We don't understand it. We
Mhm.
understand a fraction of it.
Bit of it.
But
Sure.
I think, yeah, but I think actuaries can help understand it through, as I say, understanding what the data is telling us,
Mhm.
understanding, looking at a whole bunch of clinical trials, not
Sure.
just the headline studies that, oh, we looked at 2,000 people over here and they say that this drug works better. The drug works on addressing a biomarker. I've just been working on a new article actually about biomarkers. I was asked to write this article that kind of explains about the blood tests that you take and how to interpret them, and
Right.
things like those standard ranges. Where do they come from? And
Right.
so a lot of pharmaceuticals are invented and tested on how they adjust a particular biomarker in your blood. So does a statin? Everybody knows what a statin is.
Goodness.
It
Yes.
reduces LDL cholesterol. Okay, it does do that.
Yeah.
But does it make you any healthier? No. And so it's looking
Exactly.
beyond that very narrow view of what is
Right.
this artificial chemical doing in your body to
Sure.
is it making you healthier? And so I
Right.
think the actuaries can take a much broader perspective. And of course, they're independent. They would
Right.
need to be independent. So you
Yeah.
need to look at some of the clinical trials and who is funding them to see
Uh-huh.
where the lines come from. But I
Right.
think actuaries, we have a very rigorous code of conduct,
Mhm.
extremely rigorous. I
Mhm.
mean, I know doctors do too.
Sure.
But actuaries, they're kind of out of it. They're nerdy. Everybody kind of ignores them. I don't understand what you do. You're over here. So I think in some ways, I think actuaries can still be independent,
Sure.
and can speak out. And so if you're an actuary, listen, please speak out.
Yes, yes, we need that. We need somebody to actually pull all that data together so that, as you say, it's not cherry picked, because it seems like there's people who will say on one side of an issue versus the other completely contradictory ideas and they'll pull out statistics that back it up.
Right.
And who's to say who's actually right? It sounds like somebody needs to look at, okay, so that's another thought. You mentioned that 90% effective doesn't necessarily mean 90% effective. Can you
Right.
explain why?
Right.
Yeah.
It's a little complicated math. Okay, so
Pretty thousand foot overview.
okay, so all right, so I'm gonna kind of do it on those shots, all those numbers that everybody
Okay.
was seeing. So
Yeah,
you have two groups of people, and let's just say a shot, any shot, okay,
sure.
any. Okay,
Okay.
so you've got a group of people that had no shot,
Right.
and you a group of people that took a shot, okay, and then you start measuring: did those people get the disease?
Yeah.
So how many people in the shot group got the disease, and how
Right.
many people in the no shot group got the disease? So
Right.
you might say, okay, in the no shot, two people got the disease in the next month, and
Mhm.
in the sorry, that was the what did I say? That
Shot
was the
group.
no. That's the shot group. Okay, so in the
Okay.
shot group, two people got the disease. In the
Right.
no shot group, maybe four people got the disease. So you
Uh-huh.
might say the shot is it makes it twice as effective. So it's almost
Uh-huh.
like 100% effective because twice as many people got sick. So
Right.
that didn't have that intervention. But
Mhm.
if you had 1,000 people in each group, you're
Mhm.
saying 2 out of 1,000 versus 4 out of 1,000 is a very
Right.
small number. So
Yeah.
it's the absolute risk versus the
Relative.
comparative risk. And
Right.
so yeah, it's kind of mathematical, and I know a lot of people aren't comfortable with those kinds. But all I would say is when you see the headline that only has one aspect, because the headlines you didn't see for those particular shots was
Right.
out of the shot group. If I just flip those numbers, four people had a heart attack that next
Right.
month. And in the no shot group, like one person had a heart attack. So
Right.
what's going on there? You
Sure.
know, it might be nothing to do with the shot, or there could be something there.
Right.
So, so it's people cherry pick
Mhm.
even the journalists are responsible as
Of
well.
course.
They
Yeah.
cherry pick the headlines to sell news
Sure.
or to get people to do something because healthcare it's an industry,
Right.
right? They're out to sell things.
Yeah.
And
Yeah.
so they're going to give you the marketing headlines so that you buy what they're selling.
Right. Yeah, that definitely makes sense. So, as far as the idea of the insurance companies and you mentioning like having them cover naturopathic medicine. So there is a bit of a debate amongst naturopaths as to whether or not we even want that because they also will tell you like here's standard of care. Here's all the
Yeah,
things that you have to do and also
absolutely.
we're only going to reimburse you for this amount of time. So now you're seeing somebody for 10 minutes and you can't possibly get to the root cause
Absolutely.
in
And
10 minutes, right?
yeah, and I agree with that. I absolutely
Right.
agree with that.
Mhm.
Insurance dates back nearly 100 years now, the first
Right.
kinds of insurance policies, and I think they're outdated, and I think we need something new. And
Yeah.
this is actually what I now talk to employers about, an absolute new way to fund healthcare.
Got
So I call it like a wellness first approach. So there's kind of a hybrid going on right now that
it.
many people aren't aware of. If you're a big employer,
Uh-huh.
you've got your health plan, which is kind of the traditional, conventional health plan. Like you say, there's a standard of care, and the
Sure.
doctors can do certain things, and you've got a
Right.
certain disease, and you get prescribed a certain drug.
Right.
But then employers are recognizing, well, actually, there might be a different way. And
Uh-huh.
they also provide these wellness solutions. They call them wellness solutions.
Mhm.
And so there might be a company that will help you reverse your diabetes. And it's
Mhm.
a completely different approach. And
Right.
the employer will subsidize that. So it
Got it.
might cost this vendor might cost like $100 a month. And
Sure.
for $100 a month, you get a really awesome phone app that
Yep.
helps you track your food. You get
Mhm.
access to a coach that will help you. They might recommend some supplements for you. They might recommend an exercise routine, and the
Mhm.
employer subsidizes that. And
Right.
they advertise that new plan program, I would call it,
Mhm.
to people that are diabetic or pre-diabetic, so
Right.
they can make the decision. I'm not going to go on a drug. I'm going to try this and see if this works. There's a
Right.
lot of that. Diabetes was the first. There's now programs for autoimmune conditions, all
Mhm.
sorts of different conditions, even infertility
Mhm.
and migraines and all of these different kinds of programs. And a lot of employers now, they might have several of
Right.
these different kinds of programs. But here's the problem with it. If I'm an individual, the communications I'm getting from my employer or how I choose which job I'm going to is,
Mhm.
oh, well, what's the health plan covering? I'm
Right.
nervous. I don't understand that diabetes is entirely reversible. I don't understand that my lupus is entirely can
Sure.
be reversible.
Right.
And so I want to know what the health plan is and what that will cover. If I'm going to do these other kinds of programs, well, that's going to be an out of pocket for me, even if I only have to pay $50 a month. What
Right.
I would like to see is that employers completely reduce the emphasis on the health plan and
Right.
have something that is more emergency only coverage.
Sure.
And it becomes expensive for the employees. If you want that conventional care, then
Right.
you need to pay $500 a month for that.
Mm,
If you're going to do these other kinds of programs, you only need to pay $50 a month for that. And so
interesting.
you need to try the lifestyle first. And this other kind of a plan has
Right.
all of those lifestyle kinds of coverages,
Right.
and you can pick the doctor you want to use. You can use a naturopathic doctor, but it wouldn't be insurance.
Right.
It would be the naturopathic doctor would be part of one of those
That
programs. A
program.
lot of them use like functional medicine
Sure.
doctors and things like that. And there's
Yeah.
networks each of them are building up of these integrative and alternative kinds of doctors.
Right.
And so it's not insurance. So
Wow.
so let's say I'm your patient.
Yeah.
As part of my program, I get to talk to you, and
Right.
you can talk to me for 30 minutes once a week. You can talk to me whatever your particular program is,
Right.
but the other program pays for it, and there's no
Got it.
insurance involved. You don't get told how to do it. Um,
Right.
and that's what I see. That's my vision for the
Uh-huh.
future of healthcare in this country, particularly employer funded
Yeah,
healthcare.
that's
Yeah.
fabulous. So in other words, it's almost like at least at the individual level, it's starting with incentive of where rather like there's an education component, but it's
Yeah.
also if you just
Yeah.
want to straight save money,
Yeah.
this is the better way to do it. And then
Yeah.
over time they end up learning about it. But so this also would be focused on the big employers first, and then maybe it would kind of blossom or balloon from there, kind of a thing.
Yeah, I mean, I think not the giant employers because I think they're very much, big pharma
Set
is
their
all
ways.
over them, especially the really well-known logos. But
Yeah,
I look at what we call the mid-market. So an employer that's 1,000, 2,000 employees,
right,
and the health costs for that kind of employer are huge. And they're
right.
very overwhelming and they're skyrocketing. Healthcare costs are
Mhm.
skyrocketing right
Yeah,
now.
I
So I
know.
think those kinds of employers that can really do the communication really well, can
Sure.
really speak truthfully and lay out reality. And then there's also a role for the actuaries, of course, because what I'd like to see
Right,
is when as an employee, you probably have to offer these two kinds of plans
right.
because you need to sign up for lifestyle changes, which is very hard for a lot of
Not everybody
people.
wants to, right?
Exactly. Yeah, a lot of the people just don't want it. I just want to pop a pill and I'm fine. And,
Right,
and that's fine. If that's what you want to do, go in plan A over here, or let's call that one plan B. But if
right.
you are willing to, and we'll give you a coach and somebody's going to help you and you can go gently,
Mhm,
that's plan A over here. We're going to push that
mhm,
first.
mhm.
And
Sure.
then at the end of a year or two, the actuaries can then study those two plans. And
Yeah,
here's what's been spent on the lifestyle approach first plan. So yeah,
right,
coaches can be expensive and you've got a coach you're speaking to once a week and we're
right.
paying for all those very quality supplements. You might be spending $100 a month on supplements. I think I do on
Sure,
the
yeah,
high quality supplements, and we're paying all of those. But
right,
yet, look, we've got people off all those high cost drugs.
right.
They're off the diabetes drugs, they're off the autoimmune drugs, and so we're making those savings. And then we've
Sure.
got the other plan over here that the premiums, are higher, but then there's all those prescription meds that we're paying for, and then they've got a cancer diagnosis in 2 years. And so
Sure.
monitoring how those two different kinds of plans are performing, and
Uh,
over time, again, reality will speak for
yeah,
itself.
that's fabulous. And the idea that people are self-selecting into which group they fall into as well. It's not like somebody's being, assigned to the group that's giving them the pharmaceuticals or whatever. So that's really great. You wrote an article that really intrigued me. I have yet to read it, and I need to find the article, the link for it, but it's on germ versus terrain theory, and you said it was kind of short-sighted. Can you
Yeah.
explain more? What do you mean by
Yeah.
that?
Well, first, just so everybody knows what we're talking about. So,
Yeah,
germ
please.
theory,
Uh-huh.
going back to even like the 1940s,
Hmm.
was saying that there's germs, there's these microbes that are making us sick.
Right. Mhm.
And so Louis Pasteur, you'll know Louis Pasteur from pasteurization of milk,
Yep.
so that we're not getting sick from the bugs in the milk.
Mhm.
And at the same time, and many people didn't know, there was another scientist, really, in both of these guys are in France, called Antoine Beauchamp.
Mhm.
And Beauchamp had a completely different theory that was called terrain theory. And
Mhm.
so your body is your terrain. And he was saying that keeping your terrain healthy, keeping your body healthy, will help ward off disease.
Right.
And so Pasteur was way more well connected. And so his theory basically won out, and everybody thought Beauchamp was a weirdo, and he was excommunicated, and he died young. It's pretty
Yeah,
sad.
very
But
sad.
Pasteur basically laid down what today is conventional medicine or
Yep.
Western medicine,
Mhm.
is that there's a bug or a microbe that is making you sick. And
Right.
so we've got to address that bug. It's where all vaccinology and immunology was sort of based on germ theory. But now in recent years, and not that recent, I mean, it's been building, right, for decades,
Right.
that terrain theory and how sick you are, sorry, how healthy your body is really going to influence whether you get sick or not.
Right.
So it's really, when I say that both of them are short-sighted, is because it's not really one or the other.
Right.
It's a combination of both.
Right.
But germ theory, of course, when it came out in like the 1940s, they didn't understand the microbiome.
Hmm.
Microbiome is all the bugs and microbes and bacteria and viruses and parasites and even fungi
Right.
that are living in and on our body. The
Hmm.
majority of them is in our gut and even on our skin, but this is God's design. They are not all bad.
Right.
Probably, I think the estimates now are less than 1% of them are bad.
Hmm.
99% actually make our bodies work well. And if
Benefit.
we have
Right.
an absence of them, then things are breaking down. So
Hmm.
a lot of diseases, I mean, many are due to toxins, due to nutrient deficiencies. Some of them are due to a damaged microbiome that
Hmm.
you just don't have enough of the good guys
Right.
who can keep out the bad guys and
Hmm.
can also help, they help create our hormones, they create our neurotransmitters.
Right.
So a lot of problems that we have are due to a damaged microbiome from a lot of toxins, and even the pharmaceuticals
Yep.
can damage them. So that's why I say, you can't really focus on one or the other. I think it's a combination.
Right.
Certainly there are some bad, some pathogenic bacteria, definitely. But if
Mhm.
you keep your body healthy, you're going to be robust, and you're not going to succumb to
Right.
even some of those really, really bad ones like Ebola.
Mhm.
Everybody's
Right.
terrified of Ebola.
Right.
Ebola can be completely cured with vitamin C, with really high dose vitamin C.
I
I
did
mean,
not.
right. So, I mean,
Wow.
people are terrified. They hear of these bugs and they're very
Yeah.
terrified. When there was a case of Ebola in the US, everyone was like terrified.
Sure.
No, these things can be cured. It's our bodies need the thing with Ebola. You remember people can be bleeding, some of those
Being
bleeding
everywhere. Sure. That makes perfect sense that it's vitamin.
hemorrhagic fevers. Well,
Sure.
vitamin C keeps your blood vessels solid.
Yep.
And so a lot of it, when you have any kind of virus, you're using up a lot of vitamin C. That's why in the old
Yeah.
days people knew to take vitamin C and eat some
Right.
oranges and things. But if you mentioned that during the COVID days, like, oh no, vitamin C is not going to help. Of course it's
Sure.
going to help.
Yeah, absolutely. So yeah, and I'm totally on board with you on that. Is the naturopaths tend to err more on the terrain side for sure,
Right,
but at the
right,
same time, there is a difference in virulence. Depends on what organism we're talking about. There's opportunistic infections that are no problem for somebody whose body is super healthy, and then there's some that are pretty virulent, and you have
right,
to kind of step up your game in
right.
terms of how to address those. So absolutely, I agree. What have I not asked you that you want to make sure you leave with our audience?
I think the biggest point that I think I want the audience to leave with is that your health is in your hands.
Amen.
And
Yes.
so I know it takes a bit of work to research what's going on, and it's so much easier just to go to the guy in the white coat and
Mhm.
pop a pill.
Yeah.
But just think of the long-term consequences of that. So
Sure.
I just want, so my book was really to empower people
Yeah.
to understand a little bit more, written in layman's terms. So, there's plenty of doctors who have written some fantastic books. But
Mhm.
if you're a layman, they can be a little overwhelming because they might be a little bit technical. I've
Right.
really tried to avoid any of the technical jargon. I've
Mhm.
got some pretty pictures in there, some little
Yep.
fun illustrations. You can understand just enough about how your body works to
Right.
when you have that thing happen, like you got that pain. And I'm not saying don't get your pain checked out. You've got to
Sure.
go see a doctor if you've got a pain, something weird
Sure.
is happening.
Right.
Yes, get it checked out.
Right.
But just because you go to a doctor, even a conventional doctor who
Mhm.
diagnoses something, puts a label on you, I just want you to understand, but you don't have to do the treatment that they're recommending. You
Mhm.
can do a little bit of research, understand a little bit more about it, and
Mhm.
then look at all these different options that you have available, whether
Right.
it's herbalism or acupuncture or energy medicine or
Mhm.
just addressing your nutrient deficiencies,
Sure.
whatever is comfortable to you and your lifestyle. There's a
Right.
lot of different options out there, and don't just take what the one conventional
Tell
doctor has
you.
told you to do.
Right. Love it. Awesome. Where can people go to learn more about you and to get a copy of your book?
So my home base is really my website, which is emmatekstra.com.
Mhm.
So Tekstra has a K, not an X.
Yep.
So start there. It's probably the best place to start. But I'm on Substack now. Just launched my Substack. It's kind of exciting.
Excellent.
Just emmatekstra.com. emmatextra.substack.com,
Gotcha.
and all the social media links to all of that. I have some courses,
Yep.
so Thinkific as well, but all of that, all of it links together. So if you want to learn a bit more, so I have some courses, and then the book is available. Start with the book. That will give
Yeah.
you a lot of background, and that's available everywhere good books are sold. Amazon, Barnes Noble, Target,
Mhm.
all of that. So I hope it's helpful.
Awesome. Well, thank you so much, Emma. This has been really informative. Really appreciate it.
Okay, this was great.